Hello, everyone.
Hi, welcome back to Nursing with Bonomi. We're here for another live session, so we're glad you can join us.
Give everybody a little bit of time. Hi, Oliver. You can't see my little kitty cat, but he was saying hello also. So we got YouTube and Instagram together.
Well, hope the weather's good wherever you guys are at. It's not too bad in Florida. It's been a little rainy, but I think it's going to be nice the next couple of days.
Yeah.
So we'll get some sun.
So today we are going to talk about communication. We had a couple people. I've had a couple people ask like how to talk to doctors and how to talk to family members and all sorts of things like that. So that's what we're going to do today.
Oh, come on now, Ron. You know you're always welcome. Okay. Anyway, shout out to a personal friend. So anyway.
So first we can talk about a little bit about how to call the doctor or what to say when you're calling the doctor. So we can talk about that. So some of the things you can do involves the SBAR, where it's the situation, background, assessment, and recommendation.
Yeah, and I've had a lot of experience with this over the years, and recently, in my role as charge nurse, I communicate with physicians, pretty regularly. Physicians and mid-level practitioners, mostly the PAs or NPs that are on call overnight for the hospitalists, and so when it comes to that, get your facts straight. Make sure that you look at the chart before you ask, for what you're asking for. Make sure that you have assessed the patient, that you have a fresh set of vital signs to give them because they're going to want to know those things.
I made that mistake before. They ask you a question and you're like, I didn't check that. Hold on. I have to go check. And that's awkward. Yeah. So just check first.
Yeah, and don't be afraid. And so, the R stands for recommendation. So as a nurse, you are empowered to make recommendations, to the provider because you have knowledge, you have training, you have a skill set, you have a unique ability, you have well, I shouldn't say unique ability, but you have an advantage that they don't because the physicians, the providers are with the patients for mere minutes out of a 24-hour period. You're in there perhaps for hours, depending on how sick they are. And so you have the power to make the recommendation. And so, use your skill set, use your knowledge of the disease process, for hypertension. Oh, I see they've gotten, hydralazine, they've gotten carvedilol, they've had this and that. Oh, maybe we could add some clonidine, or maybe we could add some PRN labetalol IV, or maybe we could up the hydralazine, for instance, of course, as long as they're not, tachycardic. But, so the R stands for recommendation. So don't forget about the recommendation. As a nurse, you are empowered and take that power.
If you're not sure what to recommend, you could talk to another nurse before you call the doctor, to one that's a little bit more experienced, and say, hey, my patient's got this problem. What do you think I should ask the doctor for? And like I said before in our last live, just learning more about disease processes and medications, that's how you're going to learn what to recommend. So, and if you don't know, that's fine too. I mean, the doctor ultimately is going to give an order. So
Yeah, exactly. Like, for instance, this recently I found out that, somebody with a history, of cocaine use, the practitioner was a little bit, leery about prescribing a beta blocker, you know, to help, with heart rate and, blood pressure and so forth. So, you learn new things all the time. So, and I think Naomi, you have an example?
Oh, well,
Or
do you want to talk about talking to like CNAs or something?
yeah. So as an RN, we, or an LPN in your role, I speak to the RN family, working in the hospitals. But, as a nurse, you have, the right of delegation. You're able to delegate certain tasks to unlicensed, personnel, ULPs, as they're called in the health stream modules. So, how glorious, huh? So, you have to know what's within your scope of power to delegate. And
you have to know what's in their scope of practice, who you're delegating to, what they're allowed to do.
Exactly, because, and it can be kind of uncomfortable and awkward if, they're not exactly doing their job. That's the hard part.
Mm-hmm.
That's the hard part. I mean, I don't know, some people are more brutal than others, some people are more battle axe nurses, the old boomers and Gen Xers, I don't know. I'm not quite that old yet. I haven't developed that thick of a skin.
I don't think you're going to become a boomer. I don't think it works that way.
Well, no, but as a middle-aged millennial, anyway, so yeah, it can be kind of uncomfortable talking, with somebody about their job performance. And even, this goes for people even not in a management role. For somebody who may be kind of missing the mark on doing their job, you need to, the first step is understanding. When you're having to give guidance, to somebody, um, I like to find out where they're coming from first. I like to know their viewpoint, how they see things. Kind of start with, how's your night going? How's your shift going? And you say, oh, well, I've noticed this, or I've heard that, or I've observed such and such. Can you tell me a little bit more about what's going on? And so trying to, break the ice a little bit and try to create a atmosphere of understanding. That's my approach. Instead of being, punitive right off the bat, and, and I try to end with a little bit of praise, like, hey, this, you're doing fine. This is an area you can improve in, and, just, keep trying. Of course, if something becomes habitual, then you bring it up the chain and, you talk to your manager about it. And if you are the manager, well, then you have to have a little powwow with them.
Yeah.
So, in the past, I've had, a CNA who, was hesitant to, take care of a patient with a certain disease condition. And you just have to, you provide education about it. You like say, well, this is what standard precautions are for, because, back in the 60s and 70s, before, HIV, procedures were done without masks and gloves, and people were touching blood, and it was the Wild West. I can't attest to that personally. I was yet to be born, but standard precautions, they teach you that, everybody can potentially have a communicable disease. And so you treat all of your patients like they're potentially contagious and just use common sense and you should be okay.
So did she get a little better after that or no?
I don't know. She was kind of salty, maybe like low key salty with me. So I don't know. We'll find out next weekend, I guess, if she recovered.
So yeah, that's hard to do. And like for me, I worked as a CNA for like 7 years, and then I started working as an RN at the same place where I worked as an aide. And so it was extremely, very, very difficult for me to delegate. Like, hey, can you take so and so to the bathroom? Like that was really hard for me personally. So yeah, it wasn't really till after I started working elsewhere that I was able to better delegate, because it was just so awkward for me because I felt like I was the one who should be doing it, not giving it to anybody else because I was just so used to doing those tasks myself. But yeah, so you just have to be tactful and just say, hey, can you please take so and so to the bathroom, or can you please let me know when you give so and so a shower because I need to do a skin assessment. Just being polite and but telling them what you need and not leaving it ambiguous. And generally, everything works out fine. Sometimes you are going to get people that you work with that don't really want to do their jobs. And that's where, if you have the authority, you might have to write somebody up. I mean, don't be afraid to do that if you need to. I mean, don't jump straight to that, of course. But if there's a problem, and address it, because ultimately when you do that you are advocating for the patient. So yeah.
Exactly. And I like what, Naomi said about, being kind because, my first days, my first year and a half as a nurse, I worked in a very hectic, of course, understaffed, overkill unit, sometimes with 7 patients, sometimes with total care, train wrecks. And oftentimes we didn't have CNAs, or we only had CNAs for, certain patients. And I had to do total care on 2 or 3 of my 6 or 7 patients. And I had to do all kinds of stuff. So I learned very quickly to appreciate the work that CNAs do, and to give a little bit of praise. And um, speaking of which, in communication, in my role as charge nurse, team leader, give out praise generously. Don't give it out just because, but look for specific reasons to praise your team, the people that you're working with. Like, oh, I've recognized you've had a really hard night. You've done such a good job keeping up with them, or, thank you so much for your hard work and helping out tonight. Things like that. So look for ways to praise.
Ooh,
Ooh,
I like that.
all right.
And then I do have an acronym that I wanted to share with you guys. It is, I like my acronyms.
Oh yeah. Here we go.
They don't work for me, but they work for you guys. So
Oh
here we
no.
go. I have them written down because I can't remember what they are, and I made them up.
She doesn't know them for anything.
Anyhow, it's PACED, for talking to family. So PACED. So it stands for prepare, answer questions, be confident, listen for the effect that your conversation is having, and document. So before you call the family, you want to prepare what you're going to say. Think about the questions that they might ask. Like if you're calling to tell them that their patient had a fall, well, what happened? Why did they fall? Are they okay? Did they get hurt? Well, what are you going to do? What are you going to do now? Like those are the questions that you get. So you need to be prepared to answer those questions and then talk with confidence. You don't want to be like, yeah, so he had a fall today. No, just be confident and tell him so-and-so fell. He's okay. We're going to be monitoring him closely through the next few days to make sure there's no changes, etc. And then make sure that they're understanding what you're saying. And then the last is D for document. So you want to document any conversation that you have, family member notified of patient's fall, no questions, concerns at this time. Done. So just a quick little sentence or two to just document that you spoke to them, because family members have come back and said, like in my experience, oh, nobody called and talked to me and told me about this or that. Well, I did, and I put it in the chart. So you just have to cover yourself. So
yeah, better take your Aricept, bro, because you're forgetful. So
hopefully they're just forgetful. But yes, Stuff says, look for ways to praise your CNAs. Yeah, I like it. Oh, that's what you said.
Yeah.
Yeah.
And
Speaking of Aricept.
and your nurses too, and your coworkers. So if you're in a leadership, position, I recommend, striving to attain that if you can. It's good to experience. And even all nurses are leaders. No matter what your education, no matter what your background, all nurses have the capability and the responsibility to be leaders. We're the torchbearers. We set the example. We are the highest trusted profession in this country, in the United States. If you're watching from abroad, that's how it is over here, and thank you if you're watching us from abroad. We appreciate your viewership.
Appreciate everybody's viewership. All right. Well, do you have anything else?
I remember this thing. My dad, he bought a bumper sticker from this hippie store up in Yellow Springs, Ohio. That's where what's his name, the comedian, Dave Chappelle. That's it, Dave Chappelle. We ran into him. He was on the street, on a park bench, smoking a cigarette, and his little son was dressed up as Superman, and he was just chilling and said, "Hey, what's up, Dave?" I'm like, "Hey, man." So anyway, it was cool. Anyway,
what does that have to do with anything?
No, but it was Yellow Springs. Okay, so, but anyway. All right, so I remember this bumper sticker that my dad had, and he put it on his fridge, and it said something to the effect of, "Speak your mind even if your voice shakes." So even if you have a quivering voice, speak your mind. Don't be afraid, because nothing gets done if nothing is said.
And I recently heard this phrase, like a short, sweaty conversation. It's like something that's really hard to talk about, but you really need to talk about it. And those are some of the conversations that have the biggest effects. So you just go for it, and you just do it, and then there's going to be a big effect from that conversation. So
yes, and listen to the song "Say" by John Mayer. Say what you need to say.
Say what you need to say. All right.
Quoteth John Mayer.
Thank you guys all for watching, and then don't forget to you can subscribe if you'd like, but ask us any questions that you have, and pop in like any topics that you'd like us to discuss for future lives. So
yeah,
thank you guys for watching.
All right,
Have a fabulous night.
See you next time.